So we purchased some kayaks probably 4 years ago. We kind of enjoy getting out, getting on the water, enjoying nature, getting out and traveling a little bit to different areas and going kayaking.
It was smooth sailing for Jeff Miller until he noticed he was making more frequent trips to the restroom.
That kind of impacted my ability to go out for longer periods of time. It kind of impacted our traveling to and from different places to go kayaking.
I noticed, like, when we would drive places to go visiting family, or if we were going kayaking or whatever, we would have to make frequent stops to use the restroom.
Jeff and his wife Jill thought it might just be his age.
I was thinking it was just a normal aging process going on. I mean, I turned 50 last year.
After the problems continued, Jeff decided it was time to see his doctor.
So for him to say, honey, I think I need to go see a doctor, I knew that there was something, it was becoming a serious issue for him.
They were able to check my labs and they kind of made the determination that maybe you have a prostate issue. We might need to refer you to a medical or a urologist.
And the advice couldn't have come soon enough.
I mean, it even was starting to affect my job, my work. Sitting through meetings, lengthy meetings. I had to get up in the middle of a meeting and then move out and use the restroom.
So Jeff met with Dr. Jay Rahman at the Penn State Cancer Institute.
He'd already seen an outside urologist who had made a diagnosis of high-risk prostate cancer based on a biopsy.
He did some imaging on me and found out that there was a bigger problem, that I had a large mass on my prostate.
I kind of lost it, I guess. I got very emotional. It was scary.
What was going through my mind is, how is this going to affect my future and being able to do the things that I want to do?
Now that there was a diagnosis, it was time to talk about treatment.
That includes surveillance, surgery, now considered radical prostatectomy to remove the prostate, or radiation treatments with hormone therapy.
Jeff chose surgery.
Then it was like 2 weeks maybe before the surgery is when they closed everything down. And my initial reaction was, oh my gosh, am I going to be able to go to the hospital and be there with Jeff? And of course they told me, no, you can't be here.
My wife dropped me off for surgery, wasn't able to come into the medical facility because of COVID. She was at home kind of worrying about the surgery and worrying how I did.
I think as with most things, it was a risk benefit, but for him, with a young man with aggressive prostate cancer, I think the benefits of having treatment early outweighed any of the risks associated with a COVID exposure during that time.
Of course, there's a little bit of a recovery time after that kind of surgery. So still recovering, going for regular blood work to check the prostate to make sure that there was no residual there, and everything was clean.
Life resumed as normal for Jeff until 1 year later.
The PET scan indeed showed that he had a single lymph node on the right side of his pelvis that was PET avid, or it looked hot. And this was above where I had done the lymph node dissection. And so it gave us a target where his cancer may have come back to.
So Dr. Rahman called my phone instead of Jeff's cell phone. And he's like, do you guys have a minute to talk? And my heart sunk.
It wasn't good news for sure.
It was back to the operating table for Jeff.
The understanding is that by removing this lymph node, if it had cancer, we would hopefully remove the cancer and then we would continue to follow. And obviously, if there was recurrence, then we would default to a pathway of radiation and hormone therapy.
It wasn't as big of a procedure. It was just an outpatient procedure. So, and I was able to bring him home that same day.
He's recovered very well overall. He's now several months out from that operation.
And for now, it's back to smooth sailing for Jeff, Jill, and their extended family.
He's like he was before, doing really good, enjoying life.
I have a couple grandkids as well. So just enjoying time with the family and being able to do those things is a big thing for me. And I'm glad that I'm where I am today.